I'd like to welcome Thor Rigney to the podium. He's from the Faculty of Health, and he's going to talk to us about leaving the chiropractic profession, a focused analysis of lived experience. Thank you.
Thank you very much. I appreciate that. So I'll just repeat my name. I'm Thor Rigney. I'm from Sydney. I'm an online student. So as an online student, far from the campuses, I can feel a sense of isolation sometimes. And it's so nice to be here at Praxis where I feel connected and I build relationships and I'm among people who understand my pain and my journey. So the association does more than support in skill development. The engagement is about this connection, in my opinion. And I want to thank the association for sponsoring me to be here today and giving me this opportunity to present my latest research. I would also like to thank my supervisors, my super duper fabulous, wise, generous supervisors, Professor Sandra Grace and Joe Bradbury. I think one of the most tremendous things that they do for me is they help me get out of my way and keep me moving forward. As you heard, my title is Leaving the Chiropractic Profession, a focused qualitative analysis of lived experience and burnout. So burnout is a bit of a focus because it's a popular thing within the profession. So some of you may recall that the moment of inspiration for this topic was at my first day of chiropractic school. At my first lecture, the lecturer told my cohort and me that 70% of us will not be practicing 5 years after graduation. That was quite alarming. I thought that was a lot of money and time to spend. But I'm not sure what the purpose of saying that was. But it stuck with me, and I wanted to find out more. So, of course, the first thing you do is check the literature, and I examined 30 years of peer-reviewed literature and found very little information about the topic. But there were some theories or hypotheses as to why individuals leave the profession, and they could be categorized into 4 domains: financial, which was a primary one for most of these papers, psychosocial, educational, and political were the 4 domains. Missing from them was the lived experience. So the aim of this research was to get that lived experience. So I wanted to get insights from people who have left the profession and to understand why they left, and then to use that information to construct a questionnaire that could be used for future research. It's important, by the way, to differentiate that I'm asking people who left the profession and sought employment outside of the profession. That differentiates voluntary attrition, like resignation, versus attrition that was involuntary, like death, injury, or retirement from the workforce. And so then construct a new questionnaire with all of this information for future research, which of course is my research. So I used semi-structured interviews of individuals, Australian individuals that left the profession. And I used my professional networks and snowball sampling to acquire this enrollment into my study. And I used reflexive thematic analysis with a critical realist perspective. Doesn't that sound smart? To analyze the data. And it's important for you to know that I have a particular perspective on this. So my analysis involves at the time, I was a practicing chiropractor, and I have 30 years experience as a chiropractic academic. So I bring that into this analysis. And of course, there was ethics approval. So the tool I did use a interview guide, which consisted of 15 open-ended questions that also had prompts to try to elicit more detail, more data. And the questions involved 6 domains, which are public opinion, work environment, including burnout, patient interactions, financial, professional politics, and education. The guide was validated through a process of expert review, and it was piloted. And then I chose to use the Zoom platform because it was common. Most people have it by the time I was doing this and was familiar with it. It created or allowed all sorts of flexibility for location and time because people could do it on their phones. And importantly for me is Zoom has a transcript function, and I could have the discussion transcribed, although it is very poor with its transcription, but that's very good because I had to review it over and over again to clean up the transcription, which helped with that thematic review. So the results. Okay, in my ethics, I said 5 to 8. I wanted to be very conservative because, who knows? And I got 8. I was very pleased. And so I wanted, it was an Australian perspective. 7 of the participants were educated. They received their chiropractic education in Australia. 1 received their education in the United States. Again, 7 of the participants practiced within the profession for less than 5 years. And 1 practiced in the profession for 15 years, but purposely did it at part-time and had other sources of income throughout that whole time. That was a matter of choice. So I did kind of go right into it. So now after a few lighthearted questions to ease them into it, boom, why did you leave the profession? And some of them were like, oh, okay, so that's so quick. So they gave either 1 of these reasons or 2 of these reasons or all 3 of these reasons, but these were the reasons why these 8 individuals left the profession. There were some financial issues or a sense of isolation that was not, it was too stressful for them, or there were varying levels of comfort or discomfort with the business side of the profession. So as a chiropractor, you have the clinical aspect of chiropractic, and then most chiropractors are in private practice, and then so there's the business aspect. And so there were varying levels of comfort with that business side. So with further analysis, this is where I'm going to get back here to kind of explore a little bit deeper into those reasons to find out a deeper level of understanding that what led to that decision to leave. I came up with these themes from my analysis. 1 is limits on personal life. Participant 4 was just starting a new family and was thinking that more money was needed. And he said, in order for me to grow, I have to make a lot of sacrifices. And that sacrifice would not necessarily be guaranteed. So that was, he was concerned that he would have to spend too much time in the practice to make the money he felt he needed to have. And then the feeling alone was, in the support area. So participant 1 said this, it's like, here's your room, your appointments are going to be this long, indicating a short period of time. Get on and do it. It was quite shocking, said the participant. And in regards to support, like, did you receive support? Or describe the support you received? Oh, no, but I also probably didn't seek it. Maybe I should have, said participant 5. And then when asked about describe your level of comfort with clinical uncertainty, I think participant 7 was quite clear and very straightforward, not very comfortable with clinical uncertainty. So, and then defense fatigue has to do with the negative rhetoric around the profession. And participant 2 said, there was a lot of fighting outside the profession, inside the profession. I got sick of always justifying my career and how I treat. So in the education domain, I was very pleased to hear how the students expressed how much they enjoyed their education, but they felt like the real world situation was sort of lacking. And to exemplify this, I love this one. At uni, it's all rainbows and daisies and wonderful. So that was participant 6. Participant 4, practice ready, yes. Career ready, no. And then, but real world experiences, a student clinic is not real world experiences in terms of public perceptions and public expectations. There we go. So just some preliminary considerations, and this is around the education aspect, is to basically open up more dialogue that is more frank and honest about the potential negative attitudes toward chiropractic, to help build recognition of it and resilience around it. And also to open up discussions around well-being so that it becomes normal to ask for help and feel safe to ask for help if it's needed. That seemed quite clear to me. Oh, okay. So I had to search long and hard for limitations. No, just kidding. So one thing that was limited was a limitation in my estimation was that all of the participants knew who I was, and that familiarity may have influenced how they were going to respond, in spite of my reassurance that, say whatever you feel, don't worry about it, I'm not going to take it personally. You never know how they might modify their responses. The other limitation is that this is an Australian perspective, so it's really limited to Australia and not elsewhere. So next, of course, some more research. So that is to use this information to construct a new questionnaire with this lived experience contribution, and then to administer the questionnaire, which is exactly what I'm going to be doing. So in conclusion, the reason for attrition, resignation from the chiropractic profession, the reasons are multifactorial. Burnout was a factor, but not the primary stated reason for attrition from the chiropractic profession. Negative rhetoric appears to be a unique factor influencing burnout and the decision to leave the profession. And these results do correlate with previously published material. References, thank you.
Excellent, very thorough. Thank you. Question?
Hi, sorry, it might be a little bit of a dumb question, but in the beginning
No
you mentioned professional politics. So what would you define as professional politics in this sense?
So professional politics in this sense is there's like politics outside the profession and inside the profession. Outside the profession, we have to deal with animosity with the medical profession, especially in Australia. And within the profession, if you're unfamiliar with chiropractic, there are essentially chiropractic has been, since almost its inception, has had two camps. One camp is they call it mixer, but now it might be strong, more empirical evidence-based. And the other camp is sometimes called traditional, but it's like the Palmarian, the original philosophy. It's more vitalistic. And so these two camps typically, historically, and actually fight. And so that was what the participant said, who was like, oh, there's fighting outside and there's fighting inside, and I have to justify to the outside for my career, and I have to justify inside and how I decide to treat, because, and this, like, he's like, forget it. Does that answer your question?
I also have, sorry, another one. Did you practice chiropractic like outside of Australia?
I did, and I practiced
So
here.
did you find that like a lack of support in the industry was very common workplace culture outside of it?
Would you please repeat that?
Sorry, do you find that like isolation or like the lack of support from like within the industry, is that common in other industries?
That actually, the isolation surprised me. Because it's like, well, and I even said this, you know, don't you have like a room full of people coming through you? Aren't you talking to all sorts of people every day? And no, it was a different level of contact. And I'm not the type of person to not ask for help. So, and I've always been surrounded by a huge number of chiropractors. And so I personally didn't feel the isolation. But when I was practicing in my last practice, I was alone, and I did have a better appreciation for those responses.
Okay, last question.
What did they go do? Like, did they stay in the health field or did they get out of health completely?
I did ask where they went, and I asked if if their educations supported them. And so many of them went into like in some sort of branch of insurance, you know, so they were like case managers and things like that. Some went into medical supply because they have all that anatomy and they have all that diagnostic stuff. They can really talk to MDs. And so they became support for like devices and whatever. And some of them went completely left field and opened a cafe. So, but some went into the medical fields.
I think from a personal researcher's perspective, I think your lived experience is incredible. And I think from my experience with my researchers, knowing that you're in the field and asking these hard questions, you probably got the most valuable responses versus somebody who didn't have any experience. Yeah, I think that probably added a lot of value to your research.
Yana, I appreciate the encouragement. Thank you very much.
Yeah, well done. Thank you.